good moving into this week. Very happy that the governor signed 5061 this morning. Excited about providing unemployment relief both to workers here in Washington and to our businesses. That's been a big focus of our early action. And we know that our first step economic recovery bill is in the Senate, is moving well, and has a lot of support over there. So we're excited to get $2.2 billion out to Washingtonians in so many different areas, everything from vaccine support to schools to housing to all kinds of different things. I think this also shows that while remote session can be slow and a little bit monotonous and challenging at times, I guess a little bit just like regular session is, but that we can move big bills off of the floor of the House and Senate, do great work for people. And so I'm very pleased that we're able to keep things moving. And this is all just early action stuff, and we're excited about everything else that we'll keep on doing.
Good afternoon, everyone. Thank you so much for being here, and I'll echo a lot of what Speaker Jenkins has said as well. This is a big week for COVID relief, and on Wednesday, in the Senate, we will be taking action on the House bill to make sure that people, small businesses, get the help that they need. I was very excited to actually see that Washington has gone from being ranked 39th in vaccine doses administered to 16th. We, of course, would love to be number one, but this is good progress. And it's a matter of making sure we get the doses that we need. I think the infrastructure is there to make sure that all Washingtonians can get the vaccine as soon as we're able to get the doses in. And I look forward to doing all the work this Wednesday when we're on the floor. And with that, we're happy to take your questions.
Okay, first we'll go to Rachel LaCourte with the Associated Press. Rachel.
Hi, good afternoon. Other than the COVID relief bill that's expected to be voted on in the Senate on Wednesday, what other measures can we expect to see on either floor this week?
We in the Senate will also be voting on the House measure that exempts the PPP loans from B&O tax to ensure that there's more certainty for businesses, and also a measure, we're expecting a measure from Senator Frocht related to insurance reimbursement for personal protective equipment for our healthcare providers to also be in the package. So we're really focused on the COVID-19 response this week, both relief, but also addressing some of the other important measures that will ensure that we continue to have a strong response.
Yeah, and I think in the House on Wednesday, we're aiming to move some of our beginning police accountability bills. John Lovick's bill related to Brady exclusions. Bill Ramos has a bill on auditing some of the 940 work that's happening. And then Jacqueline Maycomber has a bill on grants for law enforcement. So we're hoping to move all three of those off of the House floor on Wednesday.
And just as a reminder, the policy cutoff is next Monday. So a lot of the focus will be on committee action and making sure those priority bills get passed out of committee.
Rachel, do you have a follow-up?
I do. For Speaker Jenkins, where do you personally stand on both the wealth tax measure proposed by Representative Frame and the capital gains tax proposed by Representative Sen? And what do you think the likelihood is that either or both of those will advance?
Well, I mean, you'll be shocked to hear that I support the capital gains tax since I was the first person who ever introduced it. It doesn't say much for my success that I introduced it 8 years ago and it hasn't passed yet. But anyway, we're working on it again this year. I think that, I'm very supportive of us looking at legislation and at taxes and revenue that changes our completely upside down tax structure. And both of these bills have the chance to do that. And I think that's what's a lot of people focus on the money side of this, but we have the most regressive structure in the United States, the most unfair structure in the United States. And both of either the wealth tax or capital gains, I think has the chance to really help us start reforming our tax structure and making it fair so that we're not building every piece of this state on the backs of the poorest Washingtonians, but everyone is paying their fair share. So I feel good about both of those things. I don't, the wealth tax bill is just being heard, and so is cap gains. So I don't have a prediction yet about how they'll move. We'll work together, talking with the Senate on both of these and other options too. But I do hope that both the revenue side and the tax structure side are things that we think about as we decide how to move forward.
All right, next we will go to Austin Jenkins at the Northwest News Network. Austin.
Hi, Aaron, thanks. This is for the Senate side. There are 3 bills that probably would fall under the equity umbrella. One, 2 of them are Senator Darneal bills having to do with incarcerated individuals and specifically investigating jail deaths and creating a jail standards task force. The state hasn't had jail standards since the 1980s. And then the third is the credit scoring bill that is coming from the OIC that seems to be running into some trouble. And I'm just wondering about those 3 bills and the capacity and interest in them, especially given that the jail related ones might cost a little bit of money.
Thank you for that, Austin. I think having jail and prison standards makes a lot of sense. I was still at the prosecutor's office when we had our King County Jail go through, the federal edict and kind of change all of that. And so I think that's very important. And investigating death when it's in the custody of the state, to me, makes a lot of sense. I think we have to make sure we understand what is happening to individuals. So I know that I personally support both of those measures. I think I'm also a co-sponsor on the third one you mentioned. I believe it's a Senator Das bill. And so I will have to follow Senator Darneal's bills closely. Actually, I'm not quite sure where they are in the process. I'm guessing they'll be the exact out or will be this week. And the same thing with Senator Das's bill. I think, as Representative Sullivan said, policy cutoff is Monday. And so this is the time we're really making sure that we are addressing any of the issues that are coming up, working with stakeholders to try to get a product that can be voted by the majority of the members in the Senate.
Yeah, and I would just add on the credit scoring bill, in addition to Senator Dinger, I've co-sponsored as well. And the insurance commissioner provided my office with data on the difference in insurance premiums in my district, just in the 21st, based on credit score. And it's several $100s a year of difference between those with low credit and those with higher credit. And I think this is an issue we need to dig in. And I guess I would sort of dispute that it's taking longer. I think it's an issue that impacts a lot of Washingtonians, so we got to make sure we get the details and the policy right. But I think it is really critically important that these are the kinds of topics that we're diving into. Our caucus did identify equity as one of the top priorities for this session, and this fits into that. And we want to make sure we get the details right, but address some really basic inequities that exist in our financial system.
Austin, do you have a follow-up?
No, thanks.
Great. Next, we will go to Melissa Santos with Crosscut. Melissa.
Hi there. My question is about school counselors and school mental health for students. There's a few bills that deal with that and sort of setting up new programs to try and deal with student mental health issues, as well as I think at least one of them would expand the number per student ratio, the counselor ratio, and make it easier for people to qualify to do some of that work. I was wondering, what do you guys want to do in the budget or see overall done as far as increasing the number of counselors or mental health workers in schools? And what do you hope happens policy-wise versus budget-wise on that issue?
So just on the budget side of things, last year we attempted to invest in additional counselors in elementary schools, high poverty elementary schools. Unfortunately, that was during the time when the governor had to veto a few items because the situation was pretty grave. We need to pick up on that and make some additional investments in counselors. There's no question that the need is there. And we'll see as we're moving forward with our budget conversations. But, as far as K-12 is concerned, I think one of the areas that we need to focus is on those high poverty schools and additional counselors.
And, I'll just add, it's not just about what's going on in our schools, but taking a look at that entire spectrum. So as you know, the Children's and Youth Behavioral Health Task Force comes up with great recommendations every year, and this year is no exception. A lot of their recommendations are proviso recommendations, not necessarily policy. And so I think what you're really going to be taking a look at investment in our telehealth, that is for maternal starting at the time when women are pregnant, to taking a look at being able to seek advice on behavioral health issues. We had the UW telehealth cooperative, or I think it's called, something like that, that really has seen such a huge uptick on getting referrals from all across the state. We're taking a look at investing in more children's mobile crisis units. That's part of this. And then developing a workforce. We can try to provide access to as many people as possible, but we need those professionals who are doing this work. And so there's been a lot of effort in that regard as well, and you'll continue to see investment there. So there's a whole host of issues. We do have the suicide prevention line work being done. We have the 988 call being done. And so it's beyond just what can be done in our schools. And all of us have been hearing about what is going on with our schools and behavioral health issues with our children, and it is very concerning. We're just seeing more and more suicidal ideation or attempts being made by our youth, and it's beyond time that we start investing very, very seriously in a lot of these early intervention programs.
Melissa, do you have a follow-up?
Yes. So there is a bill, for instance, in the Senate. I think Senator Leish, you're actually a co-sponsor on this one. That would sort of talk about making sure counselors actually are able to do sort of the mental health aspect more and not get pulled into all these other things. Is there a concern? Sorry to go back to schools, but is there a concern that right now it's people who even are counselors aren't necessarily able to do that mental health work and focus on that versus other duties right now?
Well, I think it's clear that we need more counselors. And so when you have a lack of them, it means that those that are there are being oversubscribed. They don't have enough time to spend with students. So Senate Bill 5030 is in rules. I expect we'll see action on that here in the next couple of weeks. We had the COVID response that was our priority front and center, but definitely want to take that up. I also just want to highlight, we see the same challenges in the community and technical college system. I have legislation, and Representative Slaughter, the new chair of the House Higher Ed Committee, also has introduced a bill on counselors in our community and technical college system. So across the educational spectrum, we need more counselors. We needed it before the crisis, but obviously now with the COVID-related need, even eclipsing what we saw before, it's clear we need to get more folks into these positions. In the meantime, bills like 5030 that help focus their time and attention on providing direct support to students are kind of stopgap measures. But I agree with Rep. Sullivan. We've got to, in the budget, go back to where we were last session with more investments and really look across the system at getting more supports for all of our students.
Okay, next we will go to Jerry Cornfield with the Everett Herald. Jerry.
Yeah, I wanted another question related to schools and funding and the COVID package. Before the session began, it was clear public schools had two issues. They were dealing with a loss of state revenues from enrollment declines and the school bus transportation funding formula. That formula needed to be adjusted by the end of last month to avoid a decline. It now appears the COVID package is what lawmakers are thinking school districts should use that money to backfill the transportation and enrollment decline, loss of revenue. I wondered if the leadership could tell us, is that the thinking of the leadership at this time, that use the federal dollars and then that'll give you more time to resolve how to deal with the transportation and enrollment issues?
Yeah, I mean, we were pretty clear that was step one. Clearly, there's more work that needs to be done. Representative Dolan has dropped a bill in the House dealing with enrollment. I know Senator Wellman has one in the Senate dealing with transportation. As we're working on our supplemental budget, one of the things that we're really focusing on is district by district, making sure that when you look at, because every district is different, the loss of transportation funds versus the loss of enrollment funds than how much money they got from the federal package. Some districts didn't get any money, some got very little. So we need to make sure that every district has the resources necessary to provide an education for all of our students. And so we're committed to doing that. We've made it very clear to districts that we will be doing that in our supplemental budget as we move through. And, you know, I think that you'll see some, you know, very, very strong actions taken in our supplemental budget. But, you know, it'll be a little bit down the road before we get there.
Jerry, I'll just add, I think it is very critical to make sure that our schools are made whole. It's a lot has been asked of them, and I'll just say I've actually been very impressed with how well so many of them have pivoted to continue to provide education for our children. So I think it is imperative on us to make sure that really by the end of session, they are made whole.
And I just will, it's why we're all rushing to get this $2.2 billion package to the governor this week so that we can begin to see those dollars. Jerry, I looked at Edmonds, Everett, Mukilteo, and South County, and you know, with varying degrees, this goes a long way towards filling the gap that's there. So it's going to Rep. Sullivan's point, it's going to get us a lot of the way down the road, but we've got some more steps we need to take. But it is going to address the immediate need. It's why we're you know, we're less than a month into session, and we're already going to send a couple of really significant relief measures to the governor's desk to make sure we're addressing this.
Jerry, do you have a follow-up?
Yeah, it's on a different topic on vaccines. I'm reading in the Seattle Times that it appears that the vaccination is not going along equitably, that the state is vaccinating white people more than exceeding their percentage of the coronavirus cases. So what is the legislature doing to ensure that, especially at the state mass vaccination sites, it's equitable and the right people are getting vaccinated, not only who are eligible, but are demographically it's equal?
Jerry, let me start off on that. I think that one of the important things is to think about what was done a lot during testing. And it's very hard, I think, to make the mass vaccination sites more equitable. There might be things that can be done, but really what we have to do is move vaccination sites into local communities where communities, Black, Indigenous, and other people of color live, to make it accessible to them. The other, you know, challenge we have is that the way people are scheduling appointments through in a very complex way on the internet is creating serious problems, both for elderly people and for BIPOC people. I mean, actually for anyone who's trying to get a vaccine. And this is partly due to just not having enough vaccines in the system. But we're going to be getting a briefing. Our caucus is getting a briefing, I think, next week from the Department of Health on vaccine distribution. And I think that one of our pushes will be to really make sure that we're getting a more equitable distribution. And again, I find it hard to believe that the big mass distribution sites, while they're great, you're going to see huge inequities in terms of who gets their vaccines there. So we've got to move into local communities. We've got to have our local health departments work. They have this best connection with diverse communities within their counties, and we've got to be making sure that they're getting vaccines so that they can get them into those communities, and that the right people are also giving messages to diverse communities about getting out and getting vaccinated. But again, it's going to be hard as long as we're so we have so few vaccines. You may have seen that we're getting better and better and better at distributing the vaccines, but we need more of them. So I think that's something that we really need to work on doing. It's not really clear to me that legislators dropping a bill to do something is going to help. This is a thing where we've got to work with our local communities and the governor's office and the state agency to make sure that everybody's getting access to the vaccines.
And yeah, I'm just going to agree a lot with Speaker Jenkins here. You know, at the Senate, we got briefed by Dr. Shah. We heard from the Department of Health. You know, these are things that we're keeping an eye on. But a lot of it has to be done at the local level, making sure that information is available in different languages, making sure that the credible messengers who are talking about how safe the vaccines are and the manner in which they can get access to them. And so this has to be done on a lot of different fronts. And these are things we're going to continue to pay attention to and make sure that we are sending information out on whatever medium we have to ensure that the information gets to the communities that need access to the vaccines. And it does come down to supply. We simply need a lot more of the vaccines than we currently have.
Yeah, and I would just add as a closing note that the health system was not equitable before vaccines arrived. We're seeing yet the latest example of a deeply broken healthcare system that isn't equitable. We've got to address that at a fundamental level. We've got legislation on health equity zones moving through the Senate. I know that both the House and Senate have worked on expanding access to affordable care. We're talking about things like what is postpartum coverage in the Medicaid program. We're trying to look across the board at how we address the fundamental inequities in the healthcare system, and this is unfortunately just the latest example of it, and speaks to the need for deeper and more meaningful reform of the health system.
And next, we will go to Laurel Demkovich from the Spokesman Review. Laurel.
Thanks, Aaron. I want to ask about childcare. I know there's a lot of legislation around this topic, but it seems like the biggest one in both of your caucuses is the Fair Start for Kids Act, I believe it's called. So I'm just wondering your thoughts on that. And because it is so sweeping and probably expensive, do you imagine that all of it will make it to the floor? And if not, do you have any priorities related to childcare you'd like to see?
Well, I think, it's the Bills and Appropriations Committee right now. It's certainly going to be part of our budget dialogue, as far as how much we can invest this year in our early learning system. In the early action bill, there is money there for childcare for the emergent need, but in the supplemental and in the biennial budget, we're going to have to make progress again. It just depends on how much progress we can make this year. But I think you're going to see it's a high priority for our caucus, and I believe it is for the Senate as well.
Absolutely. And this was one of the things with COVID. We had someone testify in Law and Justice, and she said, COVID has given us perfect vision, right? It has clearly articulated or shown us all the inequities that exist in our society. And I think it's absolutely true. Access to childcare is also very concerning from a gender perspective. We're seeing more and more women leave the workforce because of childcare issues. And I'm very concerned of what that means moving forward. And so, again, it comes down to an equity issue like so many of the issues we're talking about right now. We have to make sure we have quality, affordable childcare that people have access to. And we really have to make sure that especially women who have left the workforce in such alarming numbers during COVID have the resources and options they need in order to get back to work. And I wish I didn't have to say women only. I wish I could say all parents, but the data really does show that this is not impacting all genders equally. It is definitely disproportionately impacting women.
Laurel, do you have a follow-up?
No, I'm okay for now. Thanks.
Okay, next we will go to Drew Mickelson with King 5. Drew.
Good afternoon, everyone. I'll just throw this out to the group. Where are we on the gun-related bills, specifically open carry and the magazine limits? Are those on track to pass?
So I'll just say we exec both those bills out of the Senate, and they are now in rules. And as Senator Elias had mentioned, we've been prioritizing the COVID bills as early action items, but they both are in rules in the Senate side. And, these were not easy hearings in the Senate, and the gun bills really aren't most of the time. But especially the one dealing with open carry, I think this year we just had example upon example, especially even in my district. I mean, the district I represent is like Woodinville, Kirkland, Redmond, Sammamish, Duval. And I cannot tell you how many parents that I know called me to say, hey, my kid really wants to go to a Black Lives Matter rally, but I don't want them to go because I'm scared for them. Is it really safe for my child to go ahead and express their support for something? And to me, the fact that in America, people are hesitating to express their freedom of speech, that they are scared to go out and have their voices heard, is unconscionable. We cannot be a country where people are silenced because of fear. And so, I'll just say I'm glad that these bills are in rules, and we will have to see how we move forward in both those regards.
And I would just add on the magazine bill as the prime sponsor that it's a great example of how our remote hearings are working. We heard from, I think, something like 3,000 people signed in on that bill, and the Law and Justice Committee listened to dozens and dozens of perspectives, and we actually have pretty significantly amended the bill. It began as addressing magazines with capacity of 10 rounds or more. It's now 17 rounds or more, really trying to respond to some of the concerns we heard identified in testimony and concerns around the constitutionality of the measure. So I think it does speak to the strength of this format. We've heard from a very diverse set of stakeholders, and we've made some really constructive changes to the bill that address a lot of those concerns of responsible gun owners. And it's now really focused on the issue, which is the accessory that's one of the most popular one used by mass shooters, which is these really, really high capacity magazines, hundreds of rounds in some cases, that are not necessary to protect yourself or to go hunting. They are really the accessories of mass shooters, and that's the bill focus now. It's in rules, and I hope that we can get consideration here in the next couple weeks for it.
In the House, we're about just a step behind, I think, the Senate. We had our hearing on the open carry bill last week. I think the bill is on the exec list this week. And so we'll see. That'll be something. It's a bill of first impression for our caucus, so we haven't had a conversation about it. I'm certain that this and other bills will be items of conversation for our caucus. So just like so many other bills, though, you got to take them step by step, moving them through the process.
Drew, do you have a follow-up?
Not today. Thank you all.
All right, thank you. Next, we will go to Sarah Gensler with McClatchy. Sarah.
This one would be for Senator Elias and maybe Speaker Jenkins as well. You've mentioned, obviously, the bill allocating federal funding, and then Senator Elias, you mentioned the B&O tax exemption as another early action priority. Can you touch on what other bills are part of that early action package at this point, and then give an idea of what that timeline might look like for getting them through the process, understanding this week's priority is getting things out of committee?
Yeah, the first priority was the unemployment compensation bill, which the governor is signing or has signed today. And then the next set is this set of bills that the Senate will be voting on Wednesday, the $2.2 billion in relief in various ways to families and communities and businesses in our state, as well as clarifying once and for all that those PPP loans aren't subject to the business and occupation tax. So this menu of, I think it is 4 or 5 bills to accomplish these goals are the very early action, but definitely endorse what Representative Sullivan has said repeatedly, that this is just phase 1 and there's more work coming. We're going to address the impacts on schools a little more in more detail in the next couple weeks. And then there's a whole host of measures around ensuring, that we're looking at health system equity, that we're looking at the impacts in the long term on the economy, not just in the short term. But these 4 or 5 bills will be on the governor's desk by the end of the week. And he signed the UI bill today, and we expect he'll sign the rest here, in the next week or so.
I agree with everything Senator Elias just said.
Sarah, do you have a follow-up?
Sure, thanks. And different topic. There seemed to be at least some initial consensus around emergency powers reform this session. Looks like there was a public hearing on one bill related to that today. Is it at this point a priority of your caucuses to move any bills to that end ahead of next Monday?
I mean, I think our focus is really on the emergency itself. I think we are taking a look at how the response has gone, but really we've got families that are struggling, businesses that are still impacted, and that's front and center for for us as early priorities. And, you know, we always want to learn from this crisis response and find ways to address these emergencies better in the future. But I wouldn't say that the urgency is to get relief to Washingtonians right now. The bills around the process will go through the usual 105-day session and the usual review. We're going to be focused more on getting dollars out the door to Washingtonians right now.
Yeah, and I just would add that, you know, I think there are a lot of bills that get heard and we kind of try to explore what their implications are. I think these emergency power bills, it's good that they're being heard and discussed. As a general rule, I have felt like the most important thing that the legislature could do is to make sure that we can call ourselves into special session. And we did that on the very first day, the opening day of session. We can do that anytime, and that's what leads us to have the ability to limit emergency powers anytime we wish to do so. I think we should be very, very cautious about moving forward on limiting executive powers. Honestly, you know, the executive powers that the governor has used, people can disagree with some of them, have different opinions. I can hear that, but you know, if the rest of the nation had used executive powers in the way that Governor Inslee had, there'd be 220,000 people in the United States still alive that aren't alive anymore. So we need to be really thoughtful as we examine those bills.
Next, we will go to Sydney Brown with WNPA. Sydney.
Hi there. So this can be for anybody, but I just wanted to follow up. I know that police accountability is something that's going to be going on this session, but specifically in regards to police use of force in the legislation that's attempting to target that. I just wanted to know how you guys feel about where those discussions are, specifically in regards to banning chokeholds and banning other, you know, canine dogs. You know, where is that legislation, and how do you feel about the ongoing discussion around it?
Thank you. You know, those, I think the two ones you picked out are exactly the ones that there's been a lot of discussion on. The canines or the police dogs, you know, that's part of Rep. Johnson's tactic bill. And so we continue to have conversations. We really want to make sure that we allow law enforcement to do the job they need to do, but do it in a way that is safe for everybody and effective for everybody. So there are, you know, we're working with a lot of stakeholders, getting a lot of input on the canine issue and the extent of that. On the chokehold issue, we actually in the Senate heard a bill by Senator Padden on that issue. Again, this is a bill that Rep. Johnson has as well. And so it really is about making sure that law enforcement has access to tactics that again, are safe for everybody, and including them. But you also have to take into account the disproportionate impact on these tactics. The fact that we have real concerns about the manner in which they have been implemented. So these are tough issues, but it comes down to trust, right? Trust that law enforcement has with the community, that the community has with law enforcement. And we, in essence, have to rebuild that trust. And so these are not easy issues, but these are issues that we as a legislator have been engaged in all summer, all winter, and continue to engage in now. And so people on all sides of this issue have had lots of months to provide their input. And now the decision is going to come to the decision makers, us, in deciding what is the best policy for our state moving forward. So the work continues, but you know, we will have a decision on both these issues. I'm very positive by the end of session.
Sydney, do you have a follow-up?
I do. This is kind of along the same lines, but in regards to going back to the open carry ban during public demonstrations, some of the criticism wasn't just from people who were very, very much about the Second Amendment. Some of the criticism was also that if you only have law enforcement be armed, what we saw over the summer is that sometimes it's the police that actually incite violence. So you could possibly be taking away protection from civilians who may need to protect themselves against the police, is what some of the testimony was. I was just wondering how much of that testimony you took into consideration when looking at that ban in particular, as well as the other gun control legislation.
You know, it bans open carry. People who have concealed pistol licenses can still have their weapons at these institutions, I mean, at these rallies or demonstrations. So to me, it's not about making sure that only law enforcement has their guns. You want individuals who are responsible gun owners, and we have data that shows that the individuals who actually have a concealed pistol license do tend to fall in the realm of those individuals that are actually responsible gun owners. So it doesn't prevent them from having their guns there. It really is ensuring that the manner in which the open carry has been used in the last few years, it really is about impeding on individuals' First Amendment rights. So there's that balancing act, and I think that change in ensuring that those individuals with the concealed pistol license can still carry there. They just don't get to open carry. Is a good compromise there, and that was always the intent from the beginning, because it's not about making sure that people can't protect themselves. It's about making sure people aren't using their weapons to intimidate others. And you know, in terms of being able to protect their property, if that's an issue, that's already provided. Individuals have the ability to have their weapons inside their businesses, inside their homes. So we'll see how this continues, but to me, it really isn't about just making sure law enforcement has guns.
Sydney, I would just add a little bit. This goes back to Senator Dingra's earlier answer about building trust within the community and between the community and law enforcement, and that's what much of many of our police accountability bills are intended to do. It's a failure at the outset if citizens feel like they need to have firearms to protect themselves from law enforcement. That is a fundamental sign of lack of trust. And that is not a place where we want to be. I understand that some people feel that way at this point. I think our goal, though, would be to try and build trust through our police accountability work, so that would never be something that any member of the public felt like they needed. I understand that there are members of the public who feel like they need that right now, but that's not a goal that we want to have for the future of relationship between our citizenry and law enforcement.
Yeah, and I would just add on that, you know, our focus is on supporting peaceful protests. I think anytime you have violence or weapons on either side, it demonstrates that the system's not working. You know, we need to return back to a place in our society where we use our words to accomplish our ends and not violence and weapons. And we've seen, you know, really bad instances this year on from various perspectives that have underscored we got to return back to peaceful protest, and the First Amendment is the way to make change. The Second Amendment is not the way that we make change in our society. It's by using our voices and using our votes to make things happen here.
And next we'll go back to Jerry Cornfoot from the Everett Herald. Jerry.
Thank you. So Speaker Jenkins, I wonder if you could clarify two things for me. First, on the vaccination, are you directly asking the governor and health folks to think about dialing back the number of doses directed to the state sites in favor of the community center sites, which there are some, and there are efforts, and to increase that? And secondly, just maybe it's in the weeds, but as a House Rules Committee meeting, I'm not seeing any agendas, but I do see bills ending up on the floor, and I'm wondering if those meetings are available to the public the way they were in the past.
The House Rules Committee will meet. It hasn't met yet, mostly because there aren't enough bills in the Rules Committee for members of the Rules Committee to pull them out of the Rules Committee. So we've mostly just been working with the Republicans to pull a limited number of bills that we knew were priorities directly to the floor. But we will be having a Rules Committee meeting. It'll probably be sometime, my guess is late next week, because we're almost at cutoff And then we're not going to be actually in floor action for a couple of weeks now. With regard to, I have not talked to the governor's office about this. My usual approach would be to ask the Department of Health and the governor's office what their plan is, and so that's what my plan is, and then to talk through how they implement it.
Gary, do you have a follow-up?
No, I'm fine. Thank you very much.
All right, thank you. That's all the questions for this week. So I'll throw it back to the members for some closing remarks.
Thanks for being here.
Yeah, thanks for joining us.
Yeah, and I'll just say, I've just been so pleased with the virtual nature of our session. It's nearly every day or close to it that I get an email or comment from someone saying, thank you so much for letting me testify remotely. And so I just want to thank everyone who's been so engaged in our process, who is logging in to testify, logging in to do written testimony, or simply signing in to show support. It really has been tremendous to see this level of engagement.
Thanks, everybody. We'll look forward to talking to you next time.
Thank you, everyone.